Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Assalamu alaikum. Myself is Dr. Saida Sataf Akbar, and I am representing Pakistan from Mali University of Science and Technology. Today is our topic is management of communicable diseases in disaster, according to Sustainable Development Goal Target 3.3. When we talk about sustainable development goals, target 3.3, it's about communicable diseases. By 2013, and the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases and combat hepatitis, waterborne disease, and other communicable diseases, we have to be very specified, and we have to control all these communicable diseases from all over the world. What is about communicable diseases? When we talk about communicable diseases, is one that is spread from one person to another through a variety of different ways that includes the contact with blood and different body fluids like blood, saliva, semen, and different types of we have cerebral fluids, breathing in an airborne viruses where we can spread different many types of diseases like COVID-19, SARS, and different types of nosocomial or communicable diseases, or by eating bitten by an insect. As such, nowadays we have epidemic in dengue, malaria, and different types of vector-borne diseases. And our topic is how to manage communicable diseases in disaster situation, in any disaster situation. When we talk about disaster situation, the what is a disaster? A disaster can be defined as an occurrence that cause damage, ecological disruption, loss of human life, deterioration of health and health services on a scale sufficient to warrant an extraordinary response from outside the affected community or area. And when we talk about disaster, so disaster means earthquake, flood, drought, any type of situation where we can face damage, ecological disruption, and many loss of human lives. This is called disaster. So when we talk about disaster management or communicable diseases management in any disaster situation, so we have two main cycles: and after event. Event means after disaster or before disaster. When we talk about disaster management cycle, so before event we have to be prepared for any type of disasters. It's a flood, drought, and earthquake, any type of disaster. And we have to talk about mitigation, and then we have faced the any disaster situation, so we have to be prepared for response and then recovery, or we can say rehabilitation. These are two phases of disaster management cycle. So when we talk about four phases of disaster response, so before disaster, when we talk about preparation or mitigation or prevention. So when we talk about prevention means plan, train, and educate for events that cannot be prevented. We have to plan, or we have to make some volunteers to prepare any disaster situation. And then we have to mitigation or prevention. It means reduce the negative consequences of a disaster or reduce the probability of any of it happening or its consequences, and different types of prevention. And then we talk about after disaster phase, so we have to respond properly, decrease morbidity, mortality, and property damage after a disaster has happened. And then we have our recovery or rehabilitation phase, action takes to return to normal life after any disaster situation. Then what are the health risks? When we talk about disaster management, is a health risk is a very vast area. In disaster situation, increased mortality and morbidity from communicable diseases is associated with different population displacement, different collapsing health services, lack of disease control programs, like poor access to healthcare in urban and rural areas, malnutrition. Nowadays we are facing a lot of about this, interrupted supplies and logistics, and poor coordination among agencies, where we have a different disconnected from modern era, or disconnection from the our urban areas. And what when we they think about the risk of communicable diseases is associated primarily with the size and characteristics of the affected population, including the following factors: amount and availability of safe water, functioning toilets, nutritional status of the displaced population. Then we have levels of immunity and vaccination coverage, levels of access to healthcare services, communicable diseases, and the associated risk factors. And then we talk about the waterborne diseases, which is a major factor of health increasing issues in any disaster situation. And then we talk about when we talk about waterborne diseases, lack of access to safe waters and inadequate sanitation facilities is the most important factor for any waterborne diseases. Like we have different waterborne diseases, and and this transmission of waterborne and foodborne pathogens. And when we talk about waterborne diseases, the five main reason for spread of disease. First one is food. Contaminated food and drink is the most important thing or most important reason to any waterborne diseases, when we use contaminated food and not appropriate drinking water. And then we have fingers, unwashed hands and dirty fingernails. Then we have feces, sewage, contaminated food. When we have no proper facilities for toilet and no proper facilities for feeding, so we have in this type of waterborne diseases. Then we have fomites, unclean utensils, doorknobs, and different. And it's the most important factor of flies. Due to different types of flies, mosquitoes, we have different vector-borne diseases like dengue, malaria, chikungunya, and different many more. And when we talk about waterborne diseases, after flood or after any disaster situation, different type of cholera, hepatitis, typhoid fever, giardiasis, leptosporidiasis, cryptosporidium. These are the main waterborne diseases which we have to face after any disaster or after any unfavorable conditions. And then we talk about vector-borne diseases. So we have different vector-borne diseases like chikungunya, kala-azar, dengue, malaria. These are the some vector-borne diseases, but these are the most major vector-borne diseases which are affect many pupils in affected areas. Increased risk of death from malaria and dengue arises from weakened immunity due to malnutrition, co-infection. When we talk about co-infection, it means when we have different people have different comorbid diseases, like we have in any disaster situation like flood, earth- earthquake. We have people who is suffering from vector-borne diseases like dengue, and simultaneously they are suffering from uh, typhoid, or malaria, or chikungunya. So it gets very much complicated to treat them and cure them. And then we have inadequate shelter increase due to increasing exposure to vectors. When we have inadequate shelter means we don't have a proper place to live or proper place to avoid these vector-borne diseases. Collapse of health services. Other vector-borne diseases in risk areas include dengue, yellow fever, Japanese encephalitis, and tick-borne illness like Congo hemorrhagic fever and typhus. These are all vector-borne diseases which we have to face in any disaster situation. And then when we talk about different communicable diseases, we cannot neglect or avoid diseases associated with overcrowding. Measles spread easily in unvaccinated population, and outbreak are common when emergencies lead to crowding in these populations. You can see this picture where is a very overcrowding situation and people living in very miserable situation. Crowding also facilitates the transmission of different type of meningococcal diseases, acute respiratory infections or syndromes, tuberculosis infection, and different type of diarrheal diseases like different type of gastrointestinal diseases, cholera, typhoid, hepatitis. All these are from the belongs to these overcrowded peoples. And then when we talk about the vaccine preventable diseases, increased risk of polio, tetanus, pertussis, and diphtheria is evident when levels of baseline immunization coverage are low. So some preventable diseases are like hepatitis, polio, pneumonia, diphtheria, rotavirus. These are all vaccine preventable diseases, and we have to have vaccinated to our people to avoid these vaccine preventable diseases. Vaccine protect individuals and communities. When we talk about any disaster situation or communicable diseases in any disaster situation, vaccine is more effective and most important cure, or we can say prevention, or we can say preventive measures to avoid different types of diseases. Vaccination not only protects you, it protects those who can't be vaccinated. So vaccination is most important. And then we talk about the rehabilitation phase. Phase is a very important thing in any disaster situation. When we talk about water supply, when we talk about food safety, when we talk about basic sanitation and personal hygiene and vector control. These four points, or we can say these four things are most important thing to rehabilitation and in our recovery phase in any disaster situation. Water supply, clean water supply is very important to avoid different type of gastrointestinal diseases or different type of water and foodborne diseases. Food safety is also very much important to avoid different type of cholera, different type of gastrointestinal diseases, hepatitis, typhoid. These all diseases related to our fecal oral route diseases, and all simultaneously related to food safety and water supply. And then we talk about basic sanitation and personal hygiene. It's most important thing to avoid different types of skin infection, different types of eye infection, different types of our communicable diseases which are easily transferred to one person to another person. And then we talk about personal hygiene. So it's most important in the affected areas where where people are very live in very crowded places. And then we talk about vector control. When we maintain our vector control, then we can prevent different types of vector-borne diseases like dengue, chikungunya, kala azar, um, and Mali University. I'm belong from Mali University of Science and Technology, Karachi, Pakistan. So when Mali University has established a disaster management cells where we are doing different types of camps and different types of recovery workshops for our people. And then risk management considerations, governments and communities can manage the risk of communicable diseases. Right? Safe water, sanitation, site planning. These things are most important. Provision of safe drinking water is the most important preventive measures to avoid different type of foodborne, waterborne, and different gastrointestinal diseases. And then we talk about planners and engineers are key to ensure safe water and sanitation infrastructure. And and then when we talk about preventive measures, the chlorine is widely available, inexpensive, easily used, and effective against nearly all waterborne pathogens. So we can use chlorine or different types of filter methods to purify our water, and we have to get a clean and drinkable water. Okay, when we talk about primary care is the most important after the any disaster situation. We have already talked about two phases of disaster management, pre-phase and post-phase. And in post-phase, we have to maintain our primary care and we have to facilitate all affected person or all affected people to give a basic need of primary care. Access to primary care at community level is critical for prevention, early diagnosis, and treatment of a wide range of diseases. When we talk about primary care, we talk about pediatrics, geriatrics, and all kind of age and all kind of genders people. And early diagnosis is most important thing to go to in any recovery phase. When we don't go any examination or any early diagnosis, we cannot identify the disease or we cannot identify or we cannot give any treatment to any affected person. So primary care is the most important thing to manage all kind of diseases after any disaster situation. And when we talk about the disaster situation or communicable diseases, of management of communicable diseases in any disaster situation, so surveillance and early warning system is most important thing. A rapid detection of case of epidemic prone diseases is essential to ensure rapid control. And then surveillance and early warning system should be quickly established to detect outbreaks and major priority endemic diseases. When we have multiple hazards with multiple users, so we have to plan our surveillance or early warning system to disaster risk knowledge. We have to prepare different types of volunteers from different institutes, different universities, colleges to prepare about any type of disaster and disaster risk knowledge. What are the risks we will have to face in any kind of disaster? And then detection, monitoring, analysis, and forecasting. This is the second important thing. Detection the multiple hazards. What hazards we will have to face if we have any disaster situation? And then we go to for monitoring, and then analysis and forecasting, and then we have to respond accordingly to what they have the analysis, what they have our forecasting, and then we have go for respond. And then as I have already discussed about vaccination, immunization, mass measles immunization, and vitamin A supplementation are immediate health priorities in areas with adequate coverage. Immunization is most important thing to avoid different types of diseases after any disaster situation like polio, different type of sinus diseases, different type of vector-borne diseases, different type of gastrointestinal diseases. So immunization is most important. And then when we talk about the vitamin A or different type of supplements, we have to boost up our immunity. And how can we boost up our immunity level? And from different types of supplements or different types of fruits or different types of energetic foods and fruits. And then prevention of malaria and dengue. This is a very I can say very major issue in any disaster situation where people living in non in any circumstances, or they don't have any proper living rooms or any shelter place. So we have to face different types of vector-borne diseases, prevention of malaria and dengue. So how can we prevent them? How can we prevent these affected people from different types of malaria, dengue, chikungunya, kala azar? Specific preventive intervention for malaria are based on an assessment of the local situation and could include bed nets, immunization, and proper and improving water drainage to reduce vector-borne sites. Water drainage is the most important thing. If we have any place where water is located, either is a dirty water, either is a clean water. When we talk about dirty water, we can get malaria, chikungunya, halaza, different type of vector-borne disease. And then when we talk about clean water, we can have dengue larva in this clean water. So we have to improve water drainage to reduce different vector-borne breeding sites. And this is the most important thing: health education. We have to maintain our planning, any sustainable de- development to health education and educate our people and our especially our youngsters, our health advocates, and different our healthcare uh, healthcare related peoples to mm, organize themselves in any disaster situation and to educate other people to how to handle in any disaster situation to deal with different communicable diseases. Health education promote good hygienic practice. Good hygienic practice when we had our COVID-19 situation. We will talk about the different types of personal hygienic practice like hand washing, mask, and many others. But in any type of disaster situation, it's also a very good to maintain good hygienic practice. Ensure safe food preparation techniques. Safe and healthy and hygienic food preparation techniques to avoid our foodborne diseases, our waterborne diseases, and our when we talk about food preparation techniques, it also include is a hygienic food. And then we have ensure boiling or chlorination of water, means filter water. Vital importance of early diagnosis and treatment for malaria, dengue within 24 hours of onset of fever. When we have fever, any type of fever, uh, shivering, headaches, then we have a sign and symptoms of dengue, malaria. or these type of vector-borne diseases. But we have to diagnose. We have to be proper and mention diagnosis system to deal with different types of diseases. Fever, body shivering, flu, cough. Uh, these four things we have in all different types of gastrointestinal diseases. The four main important things we have in our old uh, um, vector-borne diseases. But to identify, we have to go for diagnosis, and early diagnosis is most important to avoid any complications, to avoid any delay in treatment, and to avoid different type of mortality. And then we are I'm talking about the mm, Mali University of Science and Technology. Mali University of Science and Technology, as I've already mentioned, have disaster self management, where we are talking about different type of disaster management. Either is a earthquake, either is a flood, and different type of disaster. But we have to learn to manage. And what about the long term measures? Legislative administrative issues, we have to prepare, or we have to maintain our some sustainable goals, and we have to achieve or regularize our administrative issues to deal with different types of disaster. Create disaster preparedness programs and early warning system. This is most important thing. When we create disaster preparedness, so we train different type of people in different fields, like we have our mm, different institutions, different from different our universities, from different our mm, volunteers, to prepare with the proper management and proper surveillance or plannings and early warning systems. And then we have improved surveillance on a local, national, international, and global level. From tap water quality regulation and monitoring, this is the most important thing. When we talk about the tap water, we talk about malaria, we talk about hepatitis, we talk about cholera, we talk about different type of waterborne diseases which is belong to only water quality. When we regularized or maintain our good quality water, uh, we will deal these type of waterborne diseases. Enforce high standards of hygiene, personal hygiene, environmental hygiene, any type of standards of high standards of hygiene. Improve water treatment and sanitation. Keep infectious diseases control programs effective and efficient to avoid miserable situations during any type of disaster, to get our sustainable development goals in the perspective of ensure healthy lives and promote well-being for all. This is the fundamental right of all human beings to ensure healthy lives and well-being. Thank you so much.